Once you have spine surgery, especially a fusion, there is no going back. So they're either putting hardware in or they're taking something out of your back, and we can't go back on that decision. So it's a big one. What we're gonna do in this video is get the 5 definitive reasons why somebody would need surgery, but also unpack some of the reasons that we would want to avoid surgery. The number one reason why people come in and that they need surgery, and this is where our cutoff is, if somebody walks in and they're having muscle wasting. So if their leg, they're losing the muscle down their leg, and this isn't something that's debatable, it's something we can see right off, and it happens very quickly within the first week, that these muscles start to disappear. So there's 2 different types of nerve root compression. One is an active compression and one is a passive compression. So a passive compression is where any position that you get in, we're losing that nerve distribution down that leg or down other areas, but down the leg is what we see it most common. And so the muscle starts wasting away because we've lost the link that our brain has to that nerve. So if that muscle wasting happens, it typically doesn't come back. So that's where we draw the line right there. Now there's also an active compression, an irritation, and you won't see as much muscle wasting, but it happens a lot of times when people are doing activities like walking. So we had a client come in for almost 3 weeks. He was on his stomach or his back, and he couldn't sit up and eat with his family or do anything. So he had a really rough time, right? And so we got him to where we could get up. He was eating, he was doing everything that he wanted to do. His back wasn't bothering him. But then when he would go on longer walks, like about a mile, then he would start having drop foot. And drop foot is where he can't lift this part of the foot up. So that's his L4 nerve root going down to his L4, L5, going down to his anterior tip, this muscle that brings it up. He would start getting that drop foot, so his toe would start dragging on those walks. And then, so what we said, we've crossed all our T's, dotted all our I's, we've turned over these stones. Now we need to talk to a surgeon. This is where surgery comes into the scope, right? We've already checked off all the conservative things that we could do. Now, when he did an MRI, it showed that he was having a nerve compression on that L4-5 nerve root, and that's the one that goes right down to here. So it was conclusive that that compression of the disc bulge was pressing on that nerve root, and that would be a reason to talk to a surgeon. Before we get into the other reasons why you would be considering spine surgery, please hit the subscribe button. We don't want you to miss out on this playlist. We're going to be doing a ton of videos on exactly what to look for, and that playlist is going to be healing back pain or fixing back pain. It's however you look at it. But we're going to be putting up videos consistently on this. So if it's something you struggle with is back pain, then go ahead and hit the subscribe button so you don't miss out on these videos so you can actually help yourself. The number 2 reason for somebody needing back surgery or spinal surgery is narrowing of the canal. It's called stenosis. So stenosis is narrowing of the canal. Where those nerve roots come out of, that canal might be about this big, and then it gets smaller and smaller over time. And this happens as we age. We get wear and tear. We're getting arthritis. That's a normal part of aging. But as we're aging, we get more and more narrowing of that canal. And if we can't create enough space for that nerve, then it's going to get irritated consistently over time, and that's where we would consider talking to a surgeon. The canals, we have 2 different types of canals, and we have a body right here. So right in the middle of the spine right here, we have our central spinal cord coming through. That's the central canal. Now, on the outside right here, we have the nerve roots coming out. This is a foraminal stenosis. If we have a narrowing of this canal where the nerve roots are coming out and they're distributing signals to the legs, then we would have a foraminal stenosis. And we've had success with clients consistently over time creating space right there because there's a lot of muscles that are pulling on these joints and they're causing that compression. But when that nerve, when the nerve root's being compressed and it just has too much compression that we can't get it because there's bony growth around there in that stenosis, then that's a time where we consider talking to a surgeon as well. The number 3 reason that somebody would be considering surgery is if they have a sequestered disc. So a sequestered disc, this gets a little bit confusing in MRIs. People use different type of language all the time, but sequestered typically means that we have actually a break in the annula on the outside of the disc. So it kind of looks like a jelly donut. We have a pulpus in the middle, and then we have an annulus fibrosus on the outside. And if that breaks on the outside, then sequestered means that that fluid is getting pushed out. Now, it's not a death sentence. It doesn't mean that that this is a horrible thing that you can't come back from. We can't get out out of pain because we don't know where the fluid is going and we don't know if the body's going to absorb that, right? But in some instances, that's an area where they would want to do a spinal fusion. We want to avoid that at all costs. We want to turn over every stone. That's why you're watching this video, is to find out all the information that you have. You can turn over every stone. But when it's sequestered, it is more significant than a herniated disc or a bulging disc. Number 4 is bone spurs, a reason and a sign that we would want to talk to a surgeon if we have bone spurs in the spine. This is also fairly normal with wear and tear, with arthritis in the spine. We see this all the time with clients. When they come in, they'll have a bone spur. What we need to find out is it conclusive? Is the bone spur pressing on the nerve root that is distributing a signal down the leg? So it has to be consistent with the symptoms that somebody's coming in with. But bone spurs is something we can't do anything about it outside of the body, right? So a surgeon cuts and they can cut that bone spur, they can shave it down. And so that's a time where we would want to talk to a surgeon and make sure that our symptoms are lining up with the diagnosis that came back on the MRI, because the surgeons a lot of time are making decisions within the scope of surgery. When they're doing the surgery, they're making decisions for you sometimes for what your best interest is. And so you want to line that up and make sure before you get cut on, before you go under, that it is conclusive and the bone spur is causing that problem. Number 5 is tumors. A clear sign that we want to talk to a surgeon. If you have a tumor, if we see a tumor, if you feel like you have a tumor, if you look at Dr. Google, you can find out all kinds of things and you think that you have a horrible thing going on all the time. I'm guilty of it too. But I have seen this clinically before. I've been practicing for 13 years, and I had a client that came in a few years ago, and we get significant results in the first 2 weeks. So people are typically feeling much better, about 60 to 80% better within 2 weeks of coming in, and she just wasn't having that trajectory. We made about 10% improvement, and so I sent her back to a surgeon and referred her out, and they got an MRI. They found out that she actually had a tumor on her spine, and it was causing that compression. She had surgery, and then she came back to us for the rehab after the surgery, but she had to have that tumor taken out, right? And we don't know if it's malignant or benign. So if you have a tumor, we got to find out about it, and then we have to do something about it. And that would be the 5th reason that people are considering to have surgery. A major aspect of this video is considering surgery. We're the 5 definitive signs that I need to talk to a surgeon, need to consider back surgery, but also what are some things that are happening that to not consider surgery. We don't want our brain to go to the furthest thing, the most extreme intervention. We want to do more conservative things faster. We want to check off all those boxes. And most of the time, our clients that come into us after surgery, they didn't check off all the boxes. You want to check off all the boxes before you go have surgery, because now we're managing the surgery site. We want to prevent surgery as much as possible. So some of the things to look for if you're not going to need surgery is changing pain. If your pain changes when you're sitting down, standing up, walking, those changes in pain show that it's a mechanical problem that can be changed by your positions. So the position that your body's in, what muscles are pulling in certain areas, and then deficiencies. Where are we weak? Where are we not strong enough? What our body's taking the path of least resistance. Where is it not moving enough? So those are the things that we want to check off. And that's what we're going to do in this playlist of videos that we're posting, is things that you can do right now where it's an intervention and you can get some relief, and then you can test your body to see how much it improves. Then you can see if it is an extreme case and you do need to see a surgeon. To summarize this video and really get the most out of it, we're looking at 5 reasons that somebody would want to talk to a surgeon and figure out if they need spine surgery. What you need to do is find people that you trust, quality information from every different discipline that you can. Physical therapists, chiropractors, physicians, surgeons. Get as much information as you can. Make sure you trust that person, because everybody has their own motives when they do things, and we hope that everybody in medicine is looking out for the best outcomes for their clients. We should be looking at it as a team to figure out the best interventions to get the best outcomes for our clients, because that's what we're looking for, is for our clients to move around better and enjoy their life. So find somebody in each one of those disciplines: chiropractic, acupuncture, massage therapist. Try to find and work with the best people out there and get their opinions and find out anecdotal information on what they've seen with these type of diagnoses, and Don't jump to conclusions. Ask them really quality questions and hold their feet to the fire, because they're the ones that are the experts in that field. Let's find out as much information as we can to prevent this from happening. I'm going to ask you once again to subscribe to the channel, because we're going to be posting really good content with 13 years experience right now, which is only going to grow, so that you can find out exactly what happens with our clients in here, how we get the results that we're getting, and then how you can prevent surgery at all costs, and then what the signs specifically are when we start talking to a surgeon. That closes out the video. Get mobile and stay active.